All right, Dr. Mike Drzewiecki, welcome to our Spotlight series for the Movement Guild here. Appreciate you being here.
Thank you. Yeah, I appreciate you having me.
As you know, we've talked about the intention of the Spotlight series we have is to highlight those that the Movement Guild works with in terms of referrals and those people that we work with in general. You and your practice, the Neurologic Wellness Institute, is been an influential part of my practice and my recovery for some of the anxiety and dizziness that I've had. But then it's fun to send you patients, and you're also a friend. So welcome and thanks for being here.
Yeah, absolutely. Yeah. It's we've definitely had a good time over the years in various different aspects of everything. So
Yeah, I feel great. You're not only a colleague, you're also a friend. So it's fun to have you here. Tell us a little bit, Mike, about you and your practice, how you got to be where you're at, as well as
sure.
the Neurologic Wellness Institute.
Yeah. So that's our practice. We have multiple two locations in the Chicagoland area, one downtown and then one out in the west suburbs, out in Wooddale. So those are kind of our two Illinois practices. But yeah, it is primarily a chiropractic practice. So everyone in there are chiropractors, but we focus specifically on brain injuries, and those can be from severe brain injuries to TBIs and concussions and things like that to all kinds of other neurological issues. And that's the majority of our practice. So while we all are chiropractors, it is primarily a neuro rehab type of office. So I kind of got into this. I went to chiropractic school thinking I was going to do the sports chiropractic type route, and actually was just right time, right place. Was introduced to Dr. Carrick, who is really we'll say the godfather of the whole clinical neuroscience or functional neurology world, and was able to learn directly from him on some very, difficult high level cases, even
Tell
as
a
a
little bit
student.
about how you got to learn with him. It's a pretty awesome story, I think.
Yeah. It was kind of I was lucky. Like I said, he came onto our campus when I was down at Life University in Atlanta, and he started a kind of a practice there, or started seeing some patients. He would come in and do almost like a grand rounds type of thing, and it was actually over I believe it was a Thanksgiving weekend. One of my friends down there said that they needed help seeing some patients, and he knew I was going to be sticking around because a bunch of other people were leaving for the holiday. And I said, "Yeah, I'll help out for that week," and actually got to see Dr. Carrick in all of his majesty and what he was working with some of these patients, and some of them were professional hockey players, and people that I never thought that I would, or it was like a maybe some point in my career I would eventually work with these people, and then all of a sudden the first week of seeing this I was working with them, and it was kind of one of those situations where I was like, I don't know what any of that is. I don't understand any of it, but I need to learn all of it. And so then I dove in headfirst, and then started working directly with the Carrick Institute, and going through that whole learning process, which has been fantastic, and really is what led to how I can even practice how I do now. It was all from that.
I don't think the term, I mean, you and I have had this conversation a lot, like the I feel a little bit for me as a physical therapist, but certainly you as a chiropractor, the term doesn't do you justice in the license because people like, I know plenty of people that just when I tell them you're a chiropractic neurologist, the word chiropractor freaks them out. And then there's others that are upset that the two words are put together. So tell us a little bit about like the experience of what it's like to see you all. It is a different experience in terms of your intake and how you process. You're not just cracking joints. In fact, like, hardly
Right.
ever do you really
For
do
sure.
that appropriate.
Yeah, for sure. So it is. It's while we're all trained like that, while that's how I'm trained initially as a chiropractor, and everyone else who works in our practice is like that. We have the ability to do kind of the normal joint manipulation type of stuff and normal chiropractic stuff, but then beyond that, all of our training really is for the proper diagnosis and then neurorehabilitation process. So when people come into our practice, they go through a long intake process. So actually, our intake is about 3 hours long, where they do various diagnostic tests. One of those being a QEEG, so it looks at different brainwave patterns that someone has, and what is the quantity and quality of those brainwaves and how they're interacting with each other. So more so than just a normal EEG. So they do that, and then we put them in different goggles that actually look at their eye movements, and we look really closely at eye movements and how those correlate to brain health. Then we look at a balance test. We put people on a force platform, look at how their balance is. We do some cognitive testing and then full autonomic testing. So blood pressure on both sides and in different positions, lying down, seated, and standing to look at changes in the autonomic nervous system. And then we go through a full head to toe exam through the lens of how their brain is working. So it is a very thorough intake process. And it's different than what you might get at other, for sure, a normal chiropractic office. You might get musculoskeletal type of intake or examination. And it's just looking at how the joints are moving or muscles or, things like that. While we do some of that, that's just a small piece of it. And then also different than, a traditional, if you went into a traditional neurologist where they're going to they're going to have their diagnosis, which they're fantastic with, of course. And then typically they send out to, if somebody needed neuro rehab, they would then refer out to, let's say, someone like you, a physical therapist or someone
Mhm.
like that. We kind of do it all in-house. So we do that initial diagnosis, and then we build the treatment plan. And then I'm actually the one going through the treatment plan along with my the therapists that work with us to actually implement that treatment. And then it gives us the opportunity to see the person real time and be dynamic with their case. So it's we can change things on the fly as we need and as their brain changes and gets better and different things happen. So that's kind of the whole process, if you will. Yeah.
Well, I mean, I've observed it and I've sent patients for it, and I've also had it done myself. So it is, it's the most thorough exam I've ever had done. And I'm fortunate that I've learned a lot from you and taken care of classes myself. Obviously, my introduction's been through you. I'm always the one that I feel like is quiet. I don't use my work email. I use my personal email when I sign up because I'm always nervous that they're going to call me out on being the physical therapist in the room. But uh,
Right.
you know, but it's fun because you have really, I feel it's been interesting for me as a clinician to work and alongside you and be able to have so many conversations with you. But you guys are so good at applying the information. I think that's really what sets you apart, as you said, is like how thorough your intake is, but then the specificity of what you're doing, and ability to sort of find things. I've always really, when I first came to you, and we've even discussed this or watched you work, it's like I was taken back by how simplistic it was, like how simple the interventions were and like the things you were looking at, but how the depth of thought behind the assessment and what you were doing was what was really so impressive. And that also reminded me, as I said to you, about like applied functional science in the movement world. Like if you know anatomy, you can check a reaction and see if it happens, and if it's not, have the ability to work that in real time. Can you talk a little bit about that maybe, and maybe put it in the context of what after you have the assessment and you
Yeah.
did what is this, what does it feel like? I guess, one of the interesting things is a lot of times, not everyone, I think, and please talk about it, is you do intensives. So
Yeah.
tell us a little bit maybe about like what it feels like after that first session and why the intensive.
Sure. Yeah, yeah, there's a couple of things there. So it is so we initially would do that a full intake thing, and then we build out a plan that is specific to that individual person. So we don't really have protocols for anything, and like you said, some of it is very complicated in looking at, okay, where is the problem in the brain? Where are the issues? That part is the complicated part, and then building out a plan that is going to the treatment plan that's going to specifically target those areas and help rehab those areas. That is the complicated part. And then the therapies can look fairly simplistic. I mean, some are more complicated than others for sure, but it's how you target those through in like with our license being chiropractors, it's non-pharmacological, so no drugs, no surgery. It's targeting those areas through physical rehab of some sort, and that really looks like taking the best from the visual rehabilitation world, like optometry, and the vestibular rehab world and the physical therapy world and the chiropractic world, and kind of blending all of those together all at the same time, and really in the same hour. There's a lot of times that we do some physical movement type of things at the same time as maybe doing some electric stim type of things at the same time as doing very specific eye and head movements, all targeting the specific areas that we're trying to rehab. And I think that combination of doing it all together as compared to kind of piecing it out, which happens a lot of times in the neuro rehab world, seems to have a profound impact on how the brain changes and how quickly we can make changes. And some of that leads into the intensive that you were talking about, or that whole idea. There's a couple reasons for it. Sometimes we have people, because there's not a whole lot of us, we have people that fly in from all around the country, all around the world, really, to come into our practice. And when somebody comes in like that from out of town, we see them, it could be up to three times per day for a whole week. So we kind of have an intensive like that type of thing. But then we also have more for local people, where it's still pretty intensive, and they come in one time a day for about 12 days straight or so. So it's like 2.5 weeks. So they're coming in very back to back to back. And the reason why we do that is, like I said, we stack so many therapies together to try to make as big of a change as we can. And using that whole idea of neuroplasticity, or the brain's ability to learn and change and adapt, it's kind of like learning, you're a musician, it's like learning an instrument, right? If you want to learn as quickly as you can to change your brain and learn how to play the guitar, if you do it once a week, 1 hour once a week, it's going to take your brain way longer to learn how to play the guitar. Whereas if you do it 1 hour a day, every single day for 12 days in a row, you're going to be picking up on things way faster. And it's the same thing for when you're retraining the brain for anything. If that's because somebody has a dizziness syndrome, or they have a concussion that they're trying to get over, or a an autonomic issue, if you do that training over and over and over again, it changes the brain much faster. And that's what we've seen. That's kind of the theory behind it, of course, that neuroplasticity theory, but then also we've seen it in practice, and that's why we practice that way. And it makes a significant impact on people.
Tell a little bit about the QEEG. I think that's one of the really fascinating pieces about it, if you would. Like,
Yeah.
what's the role? My impression is that, sometimes the brain or the people, when they're not able to make changes, I equate it to like long-term anxiety type patients, or patients that are like have a lot of fear around their pain, which is where a lot of my learning is right now. But, can you maybe talk about that type of patient who has, the findings around their QEEG in terms
Sure.
of balances, and what you might do about it in those situations?
Yeah, yeah. So one of those tests, that QEG, when people come in, everyone gets it, and it really, there's different brainwave patterns that we have, or there's different brainwaves that we have, and some are more active when we are sleeping, let's say, and others are more active when we're just awake but calm, and then other ones, let's say like beta and high beta might be really active when we're in a high thinking mode. Okay, so like somebody who's taking a test, or having even an in-depth conversation like this, we would expect that kind of our higher activity brain waves are going to be more active. So we look at those in a control setting and see if someone is just sitting there, looking at kind of a blank wall, what are their brain wave patterns at that point. And some people we see where they have, let's say, for example, someone is, I'm sure some people can understand the whole like wired and tired thing, where they feel like, man, I'm fatigued all the time, I'm exhausted. Maybe it was because they had a head injury or life, whatever it is that's caused this, but they feel like, "Wow, I'm fatigued, I'm exhausted all the time, I could fall asleep, but then I try to fall asleep and my mind is just racing and racing and racing, and I can't actually fall asleep. So I'm wired and tired." And then we do that QEEG and we see that they have maybe elevated delta, which is your more of your sleeping type of brainwave, and they also have elevated high beta, which is that high thinking brainwave. So they're in that tired and wired state all at the same time. And so then we would do neurofeedback. Dr. Christie is our director of neurofeedback, and she sets up, same thing, we don't have protocols for that. She sets up a specific program that is it's specific to that person, but it says, okay, how can we train down those specific brain waves that are maybe overactive, or train up brain waves that are underactive, and doing that through a neurofeedback process where people sit and look at a TV screen and they're watching Netflix or something, and the EEG cap is connected to their head, and it's registering all of those brainwave patterns, and then they're watching that TV show, and as their brainwaves fall into the abnormal pattern, then the screen starts to dim out and the sound goes down. And then the technician can kind of coax the brainwaves, if you will, back into the correct pattern, and the brain has its own feedback system, and all of a sudden the screen lights back up, and over time the brain goes, ah, that's the pattern of brainwaves that we should be in, because we don't have a way in our brain to say decrease delta or increase alpha. But we do have these feedback mechanisms where if the brain gets the reward that it is looking for, i.e., looking at the TV show, then it will learn the proper pattern of the brain waves, and then you same thing intensely encode that over and over and over again to get the proper pattern set up.
Now, if you're okay, you have a few minutes. I'm going to go off subject and talk a little bit just in depth because I have you on the phone and my learnings,
Sure.
the call. But like, it's not even, so it's this gets off the research, the spotlight series, but it really highlights your knowledge. As I'm going to drop some my learnings right now, and I've been trying to understand more of like people that have chronic pain and the anxiety around it, and some of the changes in terms of salience and default mode networks and descending inhibition networks, and how that salience and default mode networks can sort of run together when they shouldn't. One should flip off when the other's on, from my understanding at a basic level. Is
Yep.
it the type of situation where when this type of thing happens, are we also going to see changes in some of these brainwaves, or are they different? Are you thinking differently? Is it kind of depend on the person, or?
I think it probably would depend on the person, but I think there is an overlap there, right? And we see changes in the default mode network, and um, abnormal patterns going on in that network, abnormal patterns going on in the salience network, and then abnormal patterns in the brainwave activity. I think those are probably all, how directly correlated they are. I'm not sure, and it is different. Every case is different with everybody. I mean, we see that all the time. There's so many people that we have come in that, they might come in with anxiety. Let's say they come in with anxiety and insomnia, and those are two things that QEG typically will pick up because of abnormal brainwave patterns, and then neurofeedback can be very good with. And then we go through the full exam, we go through the QEG, and we find out that it's that insomnia and anxiety is coming from somewhere else in their physiology and not actually brainwave patterns, where a lot of people it does fit that. So I think there's probably going to be some overlap in all of those networks. But it's different, and that's why we do those tests on everybody to see what is best for that person when we build a treatment program out.
I guess, and there's no, from my, I mean, I don't know. I don't think there's really a way to even assess the salience versus default mode network. It's more conceptual anyway, right? So
Yeah, for sure.
you can assess in your experience, just clinically, if you can sort out the brain waves, do you find that the other pieces often resolve itself? So theoretically, you could say, okay, there's more balance here.
Yeah.
I guess it's like individual to individual, but there's times where it probably works and times that it
For
doesn't work.
sure. For sure. And that all comes into all the other things that are at play too, right? So when we look at abnormal eye movements and we look at, if someone's in a pain situation and where that pain is coming from, is it central pain? Is it peripheral pain? And what role that has on the salience network. And if you correct all of those things, then obviously it changes that default mode too, and how the brain's um, and that even gets into like the psychology of things too, like how the brain is perceiving itself and its environment, and how it handles stress loads and all of that. Yeah, it's such a the brain is such a crazy thing, and
Fascinating. Yeah.
we think we know things about it, and then the just like anything, right? The deeper you get into it, the more you realize that you don't know anything about it. Obviously you know some things, and then you realize like, gosh, there's so much in there that we don't know about, or even have a hard time testing. I mean, there's so much stuff that goes on in the brain that we know happens, and even in research we know happens and stuff. But then connecting those dots even get difficult sometimes of what is consciousness and perception of reality and all of that. It's fascinating. Yeah.
And then, yeah, I mean, and then to be able to measure it or even try to attempt to measure it, you're like isolating out all the other parts of the variable. So now it's a disintegrated system that you're looking at to try to assess, and you're trying to look at and integrate everything. It becomes interesting to think about.
It absolutely does, and that's why I don't have any boring days at work. It's
What are some,
always something.
you're the guy that I send to, you're one of like a short list of people that I'll send to, it has to be the right type of person that wants to come and make the effort for such an intensive, but like you are often my stop for the tough patients. Feel like I have tend to be, and I truly, I think because I've studied with you and through the Carrick Institute and just understanding, trying to apply some of what, just apply a brain-based, I don't even know what to call it at this point, but just that like applied neural lens. If I say to people all the time, like I have the $1,600 goggles, but I'm going to send you to the guys that have the $75,000 goggles and just are able to get so much more whether that's really how much they cost, I don't know. But, just able to get more granular. And part of the reason that you guys are just so good at it. It's a pleasure to be able to send to, your business. And, most times I say, anyone in the business is good, understanding owning a business. But there are times where I'm like, go see Mike. So it's
Yeah,
a
well, I appreciate that, and yeah, it is. That's it's not uncommon. We do tend to take that's the vast majority of our patients that we see are people who have whether they have been referred in by somebody else like yourself, and you're kind of like, hey, this is as far as I can get this person, and then they come and see us, or it's nice when that happens because at least there's a directive for the patient of like, hey, go see this person or go see me, whoever it is. That's great. But we see so many people too where they have just bounced around from place to place to place, and they don't fit a perfect box or they're too complicated with whatever they have going on, and eventually they come see us, but they've seen 15 to 30 other people before they get in to see us, and that happens all the time, and that's a large percentage of the people that we see for sure. So,
Well, I think it says a lot about you and your business that so many people are doing that. So, and I'll
yeah.
testify to that as well. So, what else do you want us to know about your business, Mike?
Oh, that's the I would say that's the majority of it. Yeah, it is a unique practice for sure. It's um, Yeah, I kind of went through all that, but it's fun. You'll see the biggest thing is that just the changes that you see, and there's patients that because we see people so frequently. There's a lot of times that people are in there and they're seeing other patients all at the same time, and we see such a wide demographic of patients. You might have some that are, everything from oh gosh, we have like somebody who's had a stroke, an older person who's had a stroke, all the way down to young kids who have autism, for example. And then at the same time in the office, we might have a professional athlete, a hockey player or UFC fighter, or somebody working on performance enhancement stuff, kind of all at the same time. And it's
Physical
really
therapy business owner that has a little bit of dizziness because he's too stressed out about working and running his
or
business.
that too, or that too, right? And yeah, and you've been a part of it, so you kind of see you've been in there, you've seen some of the people that are in the practice, and then it's cool when you see everyone is kind of getting better with each other, and then all of a sudden they're building relationships. So the patients are building relationships because they happen to talk in the waiting room, and they see each other getting better and stuff too. It's all pretty cool. I think we're very fortunate. I can say that I feel very fortunate with all of the people that I work with, all of the doctors and the staff and all that, just everyone seems to really enjoy what they do. And I think that directly leads to amazing outcomes for patients as well. I think it's all part of the whole healing process.
Yeah, I agree. You guys, everyone is great there, and it's fun to watch you guys. And then the other thing, and then we'll kind of wrap up here. I mean, I also appreciate. I also think we do a good job of this is like when we're not able to help people, because there's times even I referred you somebody not too long ago, and you said I don't, I think you ended up not. I think they're going to come to see you for the QEEG now, but there wasn't much for you to do after. So you're
Yeah,
also really good at being like, I don't think this is the right place for you.
for sure. And that happens from time to time too.
And then also having the people that you're going to refer to, because it is a group, and it is like you can't handle everything. So you also have a good network of people.
Without a doubt, there are definitely cases, and that person specifically, yeah, we went through it, and that's a good thing, right? Like there's times that we see people, and you say, hey, you know, we can say that this is good, this is good, this is good, all these things are good, and there's actually one thing that's just a little bit off, but that's maybe causing all of your symptoms. And this person in particular is like, now you go work, you can work on this stuff at home. That was that scenario. There's other people that, yeah, I tell everybody that when they come in, my job is to try to put these pieces of the puzzle together and see make sure that it makes sense in my head. And if it does, then that's better for you. And sometimes we put the pieces of puzzle together and it's just not quite fitting, or it's not something that is in our wheelhouse, or we find that there's something else that's going on. Let's say there's a chronic infection, somebody has Lyme disease, or they have a mold toxicity, or they have something like that, and that's actually the primary driver, then yeah, we absolutely refer out, and we have a very good network of functional medicine practitioners and optometrists that we work with, and psychologists or therapists. So whichever way, if we need to, if the patient isn't the right fit for us or we're not the right fit for them, then we direct them to where they need to go, the same way that you do sometimes when you send people to us. So that's absolutely that's a strong point for all of us too. We are all I think we all of our docs in our office take pride in that part where it's we will absolutely on day one tell you if we think that we can help you, and the only way we'll tell you that is if we have a very strong thought process behind it. We're not going to guess and throw darts at the wall and say, oh, I hope that this works, or do this protocol and we'll see what happens. It's we should have a really strong idea if we think we're going to help somebody. But then also if we don't think that we can help, then we're very straightforward and honest with people on day one with that too, and then try to point them in a different direction that where they might find help.
What's your website? Where can we find you? All that stuff.
Yeah, the Neurologic Wellness Institute.com. And then we have a Facebook page, same thing, Instagram, TikTok now, I think even. I know all that stuff. But yeah, and then yeah, all of our information as far as like booking and phone numbers and all that stuff is all through our website. And there's a lot more information on our website too that kind of talks about our thought process behind things, and you can get a really good idea through the site too.
Appreciate your time today, Doctor.
Yeah, my pleasure. Thank you. I appreciate it.